What's going on, guys? Tony Maritato, licensed physical therapist, and in this video I want to talk to you about 3 important points related to elevating the surgical side leg after your total knee replacement. So, important point number 1. If you're elevating the lower extremity to reduce swelling, to reduce edema, you have extra fluid that's accumulating down into the foot, the ankle, lower leg. Studies suggest that we want to have the leg, the entire leg, elevated where the hip joint is at about 45 degrees or higher, and preferably the knee is in full extension. So let's break these down into 2 components. So the hip should be at about 45 degrees or higher to allow gravity to bring the fluid back down into the system. When you're sitting in a chair and the leg is down, when you're standing and walking and doing your exercises, fluid tends to accumulate down into the lower leg. There's something called pitting edema. If you want to look it up, I'll try to post a picture of it right over here. But pitting edema is basically where if you squeeze the ankle for 10 seconds or so and then you let go, you can see those indentations in the skin. That's pitting edema. We want to get that fluid back out into the system so it can be processed by the kidneys and taken out of the body. We also want to make room for fresh blood, oxygen, nutrients to come into the tissue. Exercise absolutely is one of the best things following a total knee replacement, but at the same time, exercise is going to bring fluid into the area, and it might not be as efficient at getting the fluid back out. So during your rest breaks, you might have been told to lay flat on your back with your leg elevated. The hip joint at 45 degrees or higher is the goal for that. Sitting in a recliner with your legs up, that is not considered elevation. You're flat on your back, hip at 45 degrees or higher. The reason why we want the knee in full extension is generally for individuals who are still limited in what we call terminal knee extension. So when we're measuring the knee joint range of motion, as you bend the knee, that's called flexion. We want you to be at 90 degrees or greater. As you extend the knee, that's extension. We want that to be 0. And so if you're limited, if you don't have full extension, when you're laying on a wedge and you're elevating the lower extremity to allow the fluid to come back out of the foot, the ankle, the lower leg, having that knee in extension might be more beneficial than having it flex. Now, they sell 2 kinds of wedges. They sell a straight wedge that goes straight up. I've got videos on that. And they sell a wedge that goes up and then kind of has a platform on it. That lets the knee rest in a flexed position. That's not always as ideal to increase knee extension, range of motion. So I want you to consider, 1, do you have full range of motion at the knee? If you do, you can find whatever position is most comfortable. 2, are you doing this to reduce the edema in the lower extremity? If you are, we want to get that whole leg higher than the heart, basically, which means that you would be laying flat on a couch, you'd be laying flat on a floor, flat on your bed with 3 to 4 pillows, kind of working that ankle up so your hip is flexed to about a 45-degree angle. The third component that you can consider and consult with your therapist, consult with your surgeon, is maybe a little compression wrap to help give you some kind of added compression to move that fluid out of the area. You can do a spiral wrap. You can start from the toes. You can work all the way down the leg. You can go as high as the hip into the crease of the groin. Usually it's going to take 2 long wraps that are 6 inches wide. I've got other videos on that if you're interested. I'm not a lymphedema expert, so I would recommend you consider reaching out to a lymphedema specialist. You can do that through telehealth, through a video consult. They're widely available across all 50 states, and they just do an amazing job. But the idea is that you combine all of these things. You get the hip flexed to 45 degrees or higher. You have the knee in full extension. You add a compression wrap to help a gradient move the fluid from the foot, the ankle, into the knee, into the hip, back into the system. You are going to do phenomenal. But there's a lot of misconception out there. I hope that this video helped cleared some of those questions you might have had. Of course, you can use cryotherapy, you can use other devices. There's pneumatic compressive devices that work really well too. Use what you have, talk to your therapist, find the resources that are available to you, and I wish you the best. If you have questions, reach out to me, let me know. I know I went kind of quick on this, but I just wanted to get this video out because somebody was asking specifically about this in the Facebook group, and I promised a video. Guys, I'll catch you next time.